Understanding steroid joint injections, pre-procedure guidance for patients. Steroid joint injections are a widely used treatment to help manage pain and inflammation in joints and soft tissues. This guide will walk you through everything you need to know, from understanding what these injections are, to preparing for your appointment, to post-procedure care. Steroid injections, also known as corticosteroid injections, are a medical treatment that involves delivering a potent anti-inflammatory medication directly to the affected area in your body. These injections help reduce inflammation and alleviate discomfort in conditions like osteoarthritis, inflammatory arthritis, nerve compression, e.g. carpal tunnel syndrome. These injections help to relieve pain and enhance mobility, enabling individuals to regain their quality of life. However, it's essential to know that the steroid may take up to a week to start working. Although steroid injections are effective for many, there are certain scenarios where you should avoid them. Infections. If you have an infection in the problem area, joint, or elsewhere in your body, the procedure should be postponed. Upcoming surgery. If you are scheduled for joint replacement surgery within the next 3 months, a steroid injection may increase the risk of infection in the new joint. Patients on blood-thinning medications, such as warfarin, need to have their INR levels within the safe target range before proceeding. Your healthcare provider will evaluate your medical history and current condition to ensure the procedure is safe for you. Steroid injections are not a permanent solution, but they can significantly alleviate pain for a period of time. The positive effects typically last up to 3 months, though this may vary from person to person. Regular follow-ups with your clinician can help monitor your progress and determine the best course of action moving forward. Being well prepared for your steroid injection procedure can make the process smoother and less stressful. Here's what you need to keep in mind. Have a bath or shower before your appointment. Wear loose and comfortable clothing that will allow easy access to the injection site. You can eat and drink as normal before and after the procedure. Most patients can continue taking their regular medications. Upon your arrival, the medical team will provide you with a consent form and explain the procedure, potential risks, and side effects. This is your opportunity to ask any questions or voice concerns before signing the form. The healthcare practitioner will prepare the injection and mark the injection site on your skin. The area will then be thoroughly cleaned with antiseptic to prevent infection. You will be positioned comfortably, either on an examination couch or at a desk. The steroid injection, usually paired with a local anesthetic, will serve to numb the area briefly while delivering the steroid. Post-injection care. A dressing will be placed over the injection site, which can be removed the next day. The procedure is typically quick and straightforward, but you may still have questions or concerns. Don't hesitate to speak with your healthcare practitioner at any stage. While steroid injections are considered safe, it's vital to be aware of potential risks. Common side effects: temporary skin flushing, skin depigmentation, dimpling of skin at injection site, subdermal fat thinning. Rare side effects: infection, 1%, minor bleeding, 1%, or tendon rupture if injected too close to a tendon. Failure rate: approximately 30% report little to no improvement in symptoms. For patients with diabetes, a temporary rise in blood sugar levels may occur after the injection. If you manage your diabetes with insulin, monitor your blood sugar levels carefully and adjust your dosage as advised. After the procedure, most patients are advised to wait in the clinic for 10 to 15 minutes to ensure they are feeling well. Here are some key tips for aftercare. In most cases, you can drive immediately after the injection. Rest the affected area for 72 hours to maximize the injection's effectiveness. Avoid strenuous activity during this period. Monitor for infection. Although rare, watch for signs of infection like redness, warmth, swelling, or persistent pain. If these occur, contact your healthcare provider promptly or call the NHS helpline at 111. Early intervention for complications like septic arthritis is critical. Steroid joint injections are a safe and effective treatment that can provide relief from pain and inflammation. By understanding the procedure, preparing adequately, and following aftercare instructions, you can ensure a smoother experience with optimal results. If you have further questions or concerns, consult with your healthcare provider to make informed decisions about your care.